Good morning, everyone, and welcome to the Sunday Deep Dive. Thank you for joining us. This morning, we have our very own Pierre Vakale with us. Pierre is not only on eldership here at NCCB, but he is also a highly respected ophthalmologist and an all-round passionate doctor and passionate Jesus follower. So it's great to have you with us. Hi, Pierre.
Thanks, Claudia. Morning.
So this morning, we were feeling that we needed to open up some dialogue around COVID-19 and some of the prevention options that are becoming available, just to hopefully bring some clarity on the subject. Just to note that we are live this morning, and so if you have any specific questions, we would love to hear them, and we'll try and answer as many as we can. So Pierre, maybe just give us an idea of what has the pandemic so far looked like? What can you tell us so far?
Yeah. So look, it's been an exceedingly difficult year for a lot of people. It really has. It's been a year of tremendous loneliness, and for people that have lost family members and loved ones, it's been a very, very uncomfortable, unpleasant year. And that generates enormous fear as well. And then on top of that, we've been fed just unprecedented amounts of misinformation. And just downright conspiracy theories that make it very difficult for people to know what's truth, what's not truth. And this is right from the beginning. It was initially punted as a hoax that it was 5G doing this, and of course all of these things have been completely dispelled with time, but it's just generated a tremendous amount of mistrust. And not only that, but uncertainty and just downright hostility and anger for a lot of people. And so it's good to just open a dialogue to just possibly dispel some of this myth and to just engage in a conversation that might help people make decisions in terms of vaccination, where to go, treatment for COVID, for your family, because this is a very personal thing, especially for parents. And yeah, just to say, some of this is from a scientific point of view, and it probably represents what the scientific community is saying about COVID in terms of the work that I do. But some of it is also theological and really based on what the heart of the leadership of Bryanston New Covenant is saying and what we feel about the way forward for this next year.
Sure. I mean, if we find ourselves in this pandemic and essentially no one's been unaffected by it, and we're coming to a place now where suddenly there are some preventative options becoming available to us, and we should be feeling hopeful, we should be feeling somewhat relieved by it, and yet we're surrounded by the sense of confusion, and there's a lot of conspiracy going on, and it's quite a strange place. So, and you've said that whole thing about there is so much misinformation going on, and I mean, we know as we start to Google and engage with things on social media, that also gets fed into an algorithm, and we in essence get fed a diet of our own bias, and that just keeps growing. And I think as long as we realize that is happening, that we're all aware that we each carry a bias, and both of us are from more medical backgrounds, and so our bias would be towards that side, but recognizing that we are being fed what our bias says, and we're not always getting that full picture. But one of the things, when we were looking up this information and doing some research, I really went to all sides of the dialogue. I wanted to hear what is everyone saying about it. And what I noticed was that, as I watched some of the videos and read some of the stuff about it, that as I watched it, I just noticed that I was becoming quite fearful in watching those things. And I actually had to go back to the Lord and say, Lord, you haven't given me a spirit of fear. You haven't given me that. You haven't got that spirit of confusion. He said, you've given us love, power, and a sound mind. And so, Lord, just praying, Lord, would you help me to engage this information outside of that space of fear? Pierre, did you want to maybe chat about that? For me, it then made me quite cautious about what was I going to share with people as a result, because the last thing I want to do is share fear or anything like that.
Yeah. Look, the misinformation has been quite amazing, and you're absolutely right. None of us are immune to propaganda of any sort. We really aren't. And yet there is still science. And it's to just bear that in mind. It's to keep that in mind. I think we look at this journey in terms of making decisions. And do we want to make decisions based on sort of a paranoid fear and a mistrust? No, we definitely don't want to do that. Do we want to just make decisions on a gung-ho, well, whatever maybe can happen? No, we don't want to do that either. We want to be really led by the Spirit in this, and we want to make decisions that are wise and rational and that are really for the benefit of the community that we live in. And I think that's so important. Do we have all the answers? No, we don't. We know that. And when you're in a situation where there aren't all the answers, it creates this perfect environment for conspiracy theories. So what's our anchor in times like this? And I think it's quite important to kind of keep that front and center. What did God command? He says, love the Lord your God with all your heart, all your mind, and all your soul, but love your neighbor as yourself. So in preparing this and looking at it, we kind of look at what does it look like to love your neighbor? And in fact, there's a scripture in Romans 14, and if you just look at Romans 14 as a whole, it's a brilliant, it's just a brilliant passage on what love looks like, especially in a situation like this. You'll find a lot of people will say, well, bring it on, I've got the faith for it, I'm not going to be affected by this, and I'm just going to carry on living my life as if nothing's happened. And if you look at it, Romans 14, from verse 14 onwards, it says, I'm convinced, being fully persuaded in the Lord Jesus, that nothing is unclean in itself. And Paul is talking about what he eats, that he can eat anything, whether it's pork or mussels or crayfish. And but he goes on to say, but if anyone regards something as unclean, then for that person it is unclean. So if your brother or sister is distressed because of what you eat, or let's also say because of how you behave, you're no longer acting in love. So do not by your eating or by your behavior or by your not wearing a mask or imposing your affection on somebody, destroy someone from whom Christ died. So if there's something or a behavior that we are doing that possibly causes a brother or a sister to stumble or become sick, I think we should be looking at that type of behavior. What is of benefit, not just to me? Maybe I've got the faith that I'm going to be completely untouched by this, but it doesn't mean that everybody has. And so let me behave in a way that's appropriate for people that maybe don't have the faith to walk this journey and be unscathed, that are at high risk or that are anxious. That's what love looks like. What does love look like in a pandemic like this? It looks like putting on a mask, keeping your social distance, keeping your affection to yourself and maybe your family that you live with, and not imposing your great, amazing faith on somebody that doesn't have that. And we look at the Levitical law in terms of what was the social recommendations that God put forth when there were these pandemics that went through Israel, and there were plagues that went through Israel. And it's so clear, Leviticus 13 and in Exodus, where it says, if you are contagious, keep your distance and cover your face and your nose. I mean, that's Levitical law. You look at the quarantining for 7 to 14 days, that comes out of Leviticus. That's where we get that from. And it's still appropriate for today. So the anchor, I think, in everything that we do is to, what does love look like? Are we loving?
I love that. I mean, I heard Chris Vallotton at the beginning of this whole pandemic saying, is this, this isn't about law that we do these things. This is about loving one another. And I think that even Ash touched on that in his preach today, where he spoke about, we love one another. And that is what it's about. I mean, if we just look at the smallpox plague, that is an incredible story. I mean, smallpox was a disease that was the deadliest, I think you can confirm that, and most contagious disease that this planet has probably ever seen. And in its time, it killed between 300 million and 500 million people. I mean, if we can grasp what that means, I mean, that's the entire population of the United States of America just gone in that time. And we can't even fathom the devastation that would have caused to families, to economies. And there's actually a picture that's going to come up shortly, just cueing our audio guys, our media guys. And, in the space of this disease, there's this young Christian doctor, and he hears a rumor that the dairy maids who milk the cows, when they've contracted cowpox, they don't seem to get sick or die from smallpox. And so, he goes on to do his apprenticeship, but it's like a divine seed was just planted in his heart that just kept growing there. And as soon as he finishes his apprenticeships, he actually goes and he explores this vaccine. And after a little while, he actually comes up with a vaccination for smallpox. And interestingly enough, the vaccination is initially rejected by a lot of people. It's rejected by the medical guys because they say, well, there's not enough research on it. It's rejected by Christians who say, but we can't take it because it's from a cow, and a cow is one of God's creatures. And so there's this bit of an uphill battle, but eventually this vaccination takes hold. And by 1980, we see that the World Health Organization announces smallpox is dead. It's completely eradicated from this earth. And when I hear that, like as a Christian, I'm thinking the kingdom of God is about destroying the works of the devil. This wasn't a case of, the disease is now being managed. We can kind of get control over it. There was no treatment for smallpox. Yeah. The disease was completely wiped off the face of the planet. And to me, that's the kingdom of God. God hated smallpox because it had all the fruit of the devil, which is destruction on it. And his solution for that was a vaccination. And so, he hates COVID-19. We have to know that he hates sickness and disease. And I just think, wow, God, what is your solution for COVID-19? As Christians, we are fervently praying that God is going to send us a solution. He is going to end this thing soon. But I wonder, will we have the eyes to see and the ears to hear what that solution is when it arrives?
Yeah.
And then just to wonder, could this vaccination be the solution that, just as it was for smallpox?
Yeah. I mean, it's a sort of a perfect strategy. If the enemy can impose a sickness onto society as a whole and then bring in massive mistrust and sort of conspiracy theory around the cure or the eradication of it, you've got a perfect recipe. Look, vaccination has had a profound impact on society. It really has. The only reason we expect our children to live beyond 5 years of age with a degree of certainty is because of vaccination. And it's been incredibly effective. And in fact, vaccination has been so effective that it's undermined itself, because there are few people alive today that have ever seen a case of smallpox.
Yeah.
I would imagine
that picture. Hey,
yeah,
that would be super helpful. I have never really looked at it. I don't know if Josh, can you get that picture up for us? Yes. That would be super helpful, just to see, because, we often talk about these things, but we don't have, in our heads an actual picture of oh, wow, this is what it can look like.
Yeah. And so when it comes up, we'll wait for it to come up. But I mean, I don't think many people have ever...
Okay.
Is it up?
It's up now. So the one picture on the side, these two kids were actually exposed to smallpox from the same source. One had been vaccinated and one hadn't. I mean, it's just an absolute tragedy. Absolute tragedy. So now, we can see it on the screen here. Carry on.
So there you have smallpox, which had between a 30 and a 40% mortality if you contracted it. And then, and the vaccination was not completely inert. The vaccination had a 3% mortality. And Jenner was in fact criticized massively for that. But his discovery actually rid the world of smallpox, which is astounding. Very few people have ever seen a case of measles encephalitis or measles pneumonia, which is deadly. Very few people have seen children with polio being ventilated until they die because they are unable to breathe. In fact, polio exists in 2 countries in the world, Pakistan and Afghanistan. For the rest of it, it's been completely eradicated. I mean, how many people have seen a teenager with tetanus arching their back until their spine snaps? Because we just don't see that anymore. And so this awareness of the severity of these childhood illnesses is just not seen anymore. And that's because of the success of vaccination. And look, there's always skepticism to vaccination. And we see this coinciding with anti-vaccine propaganda that comes in. And this has been very well studied scientifically to the extent that in the 80s, I think it was measles had been eradicated from North America. But with anti-vaccination propaganda, the levels of measles death in America by 2019 had reached emergency levels. And so there's always this degree of skepticism of vaccination, which is very unfortunate. And it is, I believe, sort of centered around tremendous misinformation. For example, in 1998, we had a Dr. Andrew Wakefield. At the time, he was paid to produce a study demonstrating that 12 children with autism had developed autism as a result of vaccine. And there was a financial reward for him from a court case that was generated. And that study has been shown to be fraudulent. He had his license revoked because of it. And subsequent to that, there have been 100 studies proving that autism has no correlation with measles vaccination. One of the studies had a cohort of 1.2 million autistic children demonstrating absolutely no correlation. That's science. And yet that rumor is perpetuated. And it's perpetuated to generate fear and support for an anti-vaccine propaganda, which is very sad. It really has been a tragedy. Vaccination is there just to train your immune system. It's to forewarn and arm your immune system to attack any virus or deadly disease process that we might come up against, COVID-19 being one of them. So is it a strategy? Vaccination, absolutely it's a strategy. And I think it is the key strategy to eradicating COVID-19. There's no doubt about that in the scientific community.
So what would you say to somebody who says, well, I'd rather take my chances with coronavirus than with a vaccine that's been developed less than a year ago?
Yeah, and it's an interesting sort of statement that I saw that being used with a lot of patients up towards in the kind of trough of the last sort of process, October, November, December, and far less now that the second wave has come in and actually sort of encroached and come a lot closer to families. And it's an interesting sort of statement. I think it demonstrates the lack of reliable information for a lot of people. And it just demonstrates the amount of misinformation that is out there. If we look at it just rationally, the risk of death from coronavirus is about 2%, slightly more than 2%. The risk of getting long-term complications from corona in those people that survive is about 10% with long-term lung disease and cardiovascular disease. And that's fairly significant. A lot of people will say, well, I'm young and healthy and I'm immune to that. Well, we can't say that because we realize more and more that we can't actually accurately predict who's going to get complications and who's going to die from coronavirus. So it's very difficult to say, well, I'm healthy, I can be gung-ho, and I'm immune to this. It also doesn't look like love in terms of protecting the people that are more vulnerable. In terms of the vaccination, and there's been a lot of criticism on vaccination with this, the vaccination is incredibly successful. And there has been massive research and an enormous number of trials looking at the safety of the coronavirus, the COVID-19 vaccines. And are there 100% certain that you won't get coronavirus after you've been vaccinated? No, they're not. They're about 95%. Yeah. But they are about 100% successful in making sure you don't get serious disease or die from coronavirus. So you weigh up those two and say, well, there's a 2% chance I might die, a very low risk with the coronavirus vaccine, and almost zero risk of dying or developing serious disease. That's profound. That's significant, and that's scientific. I think when the vaccines were launched, still in the treatment phase or the trial phase of it, there were some complications. There was a study that came out of Norway where very old and frail people seemed to suffer from fairly significant side effects from the vaccination. But in those trials, there was one trial with the Oxford trial that they did, and out of 11,600 odd patients, I think they had 168 adverse events from the vaccination. But if you analyze that, remember when we do a trial like this, we inject people with the vaccine, half of the people get injected with the vaccine and the other half get injected with a placebo. And nobody knows what's the vaccine and nobody knows what's the placebo. But bearing in mind that of those adverse effects, 81 of them were placebo adverse effects. 79% of them, 79 in terms of number, were from the injection itself. So are there adverse effects? Yes, there are. Currently, to date, from last week's data, out of the 1.9 million vaccinations in the United States, there have been 21 adverse reactions, which is very significant. Again, people say, well, I don't want to die from the vaccination. Well, out of the trials that they've done, 3 people died from the placebo after the vaccination. 2 people died following the vaccination itself. So is it a safe vaccine? Absolutely. It is a safe vaccine. Is it effective? Absolutely. It is effective. And your risk is significantly reduced with a vaccine like this. A lot of people are concerned about the mRNA and saying, well, it's a new vaccine. This whole technique is new. Well, no, again, that's just misinformation. The whole mRNA vaccine technique was developed in the 1980s. And it gained tremendous support in the early 1990s, where the technique was really fine-tuned in terms of developing a unique vaccine for different diseases, including cancer. And then the funding ran out. But the technology is about 30 years old. So is it new? Not at all. Is it safe? Absolutely. Is it effective? More than 90% effective. Is it effective in preventing death and severe disease? Almost 100%.
Yeah. I think the concern, especially around those mRNA vaccines that we're hearing coming out a little bit more, is that could it have the potential to change DNA? And so that's a concern. I would love to hear what your thoughts are on that.
Yeah, and I think people are sincerely concerned with that. And there is a concern that has gone around social media with that. And just to spell that as an impossibility with an mRNA vaccine. A lot of people say, well, it's going to change your DNA. And that just demonstrates a very poor understanding of cellular function and cellular biology. It's not possible for an mRNA vaccine to change your DNA. Yeah. In fact, many of the viruses that infect us, the virus can change your DNA and force your DNA to replicate virus. The vaccine does not. The vaccine stays in the cytoplasm and stimulates what we call the Golgi apparatus to produce a protein that your body then destroys, thereby educating itself to produce antibodies. But the vaccine cannot change your DNA. It's not possible. And it's just very sad fear-mongering that would even vaguely suggest that. The virus has an enzyme in it called polymerase, which amplifies its effect. This vaccine doesn't even do that. So it's a very short-lived vaccine. And from that point of view, it is not possible to change your DNA, no.
Thanks, Pierre. That was a great answer. The next question that we had was, so Pierre, is Bill Gates trying to track us through this vaccine?
Yeah, it's an interesting sort of concept that this was, again, I think it sort of gained momentum. It was a Facebook video that went around where they looked at the making of vaccines, and that in fact the vial and the needle on the vial of the vaccine has got a tracking code on it. And look, that is absolutely essential. If you're producing a vaccine, you need to be able to monitor and track that vaccine to see what vaccines have been used, what batches have been used, especially when there's what we call a cold chain involved. This vaccine needs to be stored at a specific temperature. And so it's critical to see what vaccines have been used and what hasn't. Now, I see Reuters has published a statement defining really that video that came out on Facebook was a hoax, and it was contrived, and it was completely misconstrued, that there was a tracking device put into the vaccine that was injected into you. And I mean, if you just think about this logically, we all have a tracking device with us. It goes with us wherever we go. It's a smartphone. And even with your cell phone off with the battery flat, you can be tracked. and overheard and all sorts of things like that with these crazy softwares that can do that. Possibly another conspiracy theory for another day. But honestly, if you tracked already and giving the algorithm so much data in terms of your input anyway, honestly, I don't think anybody's interested in tracking your movement when they can do it already. So is that a hoax? Yes, it's been proved and stated as being a hoax. No, Bill Gates is not tracking us.
All right. Another big question on the minds of Christians is, if we get this vaccine, are we going to get the mark of the beast that they speak about in Revelations? And then is this possible that we will then lose our salvation?
Yeah. So look, I'm going to change hats here, all right?
Yeah.
And this is looking at this now from a sort of a theological sort of point of view. And certainly this is the point of view of the leadership of Bryanston New Covenant Church. Look, this idea of the mark of the beast, which is very well described in Revelations, it comes around with every generation. And it's a spirit of, I think it's a spirit of fear that generates this kind of conversation and this paranoia. And unfortunately, not just the same spirit, but the same group of people that are now putting this forward as the mark of the beast because it changes your DNA. Both of them are false sort of understandings. The same group of people in the southern part of America are punting COVID-19 vaccination as the mark of the beast. And this same group of people in the 1980s, I don't know if you remember when barcoding came out, and this same group said that barcoding was the mark of the beast. And in fact, if you bought anything that was barcoded, you were supporting the Antichrist, and they prophesied that within a decade, everyone would have to have a barcode on their forehead and one on their wrist in order to do business. And if you didn't, you would be persecuted. And it's the same spirit, it's the same movement that are saying that the COVID vaccine is the mark of the beast. And look, it is, I think, a tragedy, and it's really quite ridiculous. What is the mark of the beast? I mean, I would follow a theologian, somebody like the late Michael Eaton, and he was very outspoken about this. And at the mark of the beast, it has certain requirements. It's an enforcement of a tyrannical government that require both their supporters and their opposition to be marked, whether it's symbolically or physically, with something that would demonstrate their support or rebellion against their imposition, religious or political, of their ideology. And quite frankly, COVID vaccination doesn't meet any of these requirements. It really doesn't. The COVID vaccine is not a compulsion. You are not being forced to use it. Yes, you may not be able to travel as freely. But then again, maybe if you have the vaccine and you can travel and take the gospel to the ends of the world, maybe that's what love looks like. Maybe if you take the vaccine, you will be allowed to go into nursing homes and old age homes and love lonely people that are dying. And maybe that's what love looks like. This is not a requirement that compromises your belief in Jesus Christ. Is this the mark of the beast? No, it isn't. You need a yellow fever vaccine to travel to Kenya. Is that the mark of the beast? No, it isn't. We needed BCG vaccinations before we were removed from hospital as neonates. That wasn't the mark of the beast either.
That's great. Sure. I think that'll just ease a lot of fears that people are feeling. You know, as Christians, nobody wants to be walking into something of deception, and
Absolutely.
so it's helpful. Thanks, Pierre. We actually had a live question, saying, which company's vaccine should we use? Pfizer, Johnson & Johnson? Which one would you suggest? I don't know in South Africa if we're going to have that many options. I think it's going to probably be what is available to us.
Absolutely, and that's not inappropriate. It's what we can get available to us. There are already 4 vaccines that have been shown to be very effective against coronavirus. The mRNA vaccines, and that's the sort of coalition between BioNTech, which is a German company, and the American sister company Pfizer, as well as the Oxford study or the Moderna virus, but those are both mRNA viruses. The other 2 viruses, which don't require such a significant cold chain and will probably be appropriate for an African context, are the virus particle vaccines. vaccines. They're all effective. Some are more effective than others. They're all safe. And so whatever vaccine you can get your hands on, I think is appropriate to be taking. The Moderna vaccine, and the BioNTech have been used in the United Kingdom and the USA, and they are very effective.
Great. So Pierre, we're running out of time, unfortunately, but if we can ask for any of your closing thoughts on the subject.
I think it's important to bear in mind that as a community, we're trying to support each other as a community. I practice medicine, and I don't believe that my practice is contrary to the will of God. I think that what I do is a demonstration of God's common grace to all mankind. I operate on people's cataracts to get them to see better. That's part of God's grace. And I think God wants everyone to have perfect eyesight. We use interesting things in ophthalmology. We use stem cells to regenerate retinas. That's not the mark of the beast. I don't think God is wringing his hands there saying, oh my goodness, what have they discovered now? We use gene therapy to manipulate genes in children born with retinal dystrophy so that children can see. I don't think that genetic manipulation is the mark of the beast either. That's a gift from God that we can help children born into a fallen world. So how do we love each other? I think a great demonstration of this is the rubella vaccination. For example, we inject and we vaccinate children against rubella. Their risk of being injured by rubella virus as a child is almost non-existent. But we inject children against rubella because they are most likely to be around pregnant mothers. And the unborn fetus in the pregnant mother is the most at risk for fetal maldevelopment. And that's who we're trying to protect. Who are we trying to protect by vaccination? We're trying to protect the weak and the vulnerable and the people that can't get the vaccination because of allergy. We're trying to love our community. And with the different strains of COVID coming through now, we need about a 90% vaccination or antibody rate in order to eradicate this process. And I think that's important. Don't spread gossip. Don't spread fear-mongering. Don't spread propaganda that isn't scientific and going to be causing confusion. Be part of a solution and be wise in how you conduct yourself and what you say.
Sure. Those are good closing thoughts, Pierre. Pierre, we had one last question. I don't know if you want to answer this question. Do you believe that this is all conditioning to lead up to the mark of the beast one day? Do you believe that they are testing it to see compliance? I think you kind of covered this, but I just want to answer this question.
I mean, the other part of that sort of comment, and I've listened to a lot of the sort of statements made by that sort of group, is that, and part of it was that every world leader has been intimidated with assassination to impose vaccination. I mean, if you just think about the rationality of that, it's just completely ludicrous. That's how world wars start. Is this conditioning for us to get the mark of the beast? No, it isn't. Neither was yellow fever vaccination. Neither was polio vaccination. Neither is MMR and DPT vaccination. It's a public concern to protect our communities. That's what we're trying to do as a scientific community.
Another question coming through. Why is it that the Novavax and Johnson & Johnson vaccine has 50% efficacy in South Africa compared to the UK, which was above 87%? Your thoughts?
Yeah, I can't answer that one. I'm not too sure of that. A part of me would like to say I'm not a politician in terms of that argument. But I'm not too sure where that data came from and what it's about. There were a number of different trials and there were a number of different sites of trials. And there might have been variabilities in terms of how the trial was conducted. But they are significant.
Okay, that's great. Any last thoughts on Ivermectin?
So Ivermectin is showing some extraordinary promise. Ivermectin is an antiparasitic drug that's been used in Central Africa predominantly for the last 40 years. And I think 3.7 billion doses of it have been used, and its efficacy and its safety have been demonstrated. It's also shown an efficacy against yellow fever virus, against West Nile virus and chikungunya virus and all sorts of things like that. So it's very effective in terms of preventing viral proliferation and also in terms of reducing inflammation. So it's been effective in terms of, of the trials that have been done on ivermectin specifically with regard to COVID-19, 27 of them have been randomized control studies and have shown tremendous efficacy against coronavirus in terms of its prevention, its early treatment, and its late-stage treatment. We look forward to this. It's not approved for use in South Africa, and so all we have available to us is veterinary product. And I just want to throw a caution out there. Please be very careful about using veterinary products for human use. We're not too sure of the dosage of ivermectin. We've had a family in the Free State that ended up in ICU on ventilators with significant neurological damage because of overdosing with veterinary ivermectin. We've had patients with tissue necrosis from injecting ivermectin and really damaging themselves. We'd have a number of patients with blindness because of ivermectin overdose. So please be careful with this. Use it in conjunction with a health professional. And just to dispel another rumor, people say that if you have COVID and you take ivermectin, you are no longer contagious. That is completely irrational, and please don't go down that route. You are still highly contagious, although your viral load might be lower. So ivermectin is exciting. It hasn't been certified for use by the South African Health Products Regulatory Association, and we look forward to that changing. But it's not part of our armamentarium as professionals at the moment, and we look forward to that changing should that come about. But just a word of caution, I look forward to that changing in the next month or weeks, and I trust that that will be the case.
Thank you, Pierre. Thank you for just your incredible wisdom and insight today. I think it's been very helpful even for myself, and I'm sure for many people out there. We hope that we've answered as many of your questions as we could get to today. And if you have any questions, maybe just send them through to the church office and we can see if we can help you out with that. We really just want everyone to be walking in a place of freedom and peace about this thing. And so, yeah, we thank you for joining us today, and we will see you in the week.
Excellent.
Bye, everybody.
Thank you.